Equine Hospital. Today I'm here with Dr. Wynn DeGrassi of Mountain View Equine Hospital, and she is going to be answering some client questions about breeding and foaling out. We have had quite a few questions come in about this topic, and Dr. DeGrassi is board certified in theriogenology and has practiced this for many years, so she's the perfect person to answer these questions. Do you have anything to add before we get started? All right. So first question from one of our clients is, my mare is overdue. Is something wrong?
Okay. So for those of you that might not know, mares actually normal gestational length, which means their normal length of their pregnancy, is on average, in layman's terms, it's 11 months and 2 weeks, or 345 days. So people usually will use that time to kind of use that as an indication of when the mare is supposed to be due. So they kind of get all bent out of shape sometimes when the mare doesn't foal exactly on time. And so I, in general, don't really get upset until the mare's gone 365 days, which is exactly at a year. Now, if there's other indications that make me worried, like the mare's dripping milk, the mare's been acting like she's going to foal but's not foaling, the mare has zero milk whatsoever, and we know the mare's on fescue, other things like that, then I might actually jump into action a little bit faster. But just because the mare's not actually going at her due date, I don't necessarily jump in and take action on that until they hit at a year. But two of my own personal mares actually go 365 days, and that's normal for them.
Yes.
And they're full sisters, and their mother went 365 days. So there are some horses that will go 365 days. Mares that will carry mule foals in general will go almost a year. And so if your mare is carrying a mule foal, they will go longer than what normally they would go with a horse foal inside of them. So again, just a lot of factors come into play as to whether I get excited about intervening or not. But in general, the foal will determine the time of when it's ready to come out. And so sometimes it's telling us it's not quite ready to come out, and so it needs to cook inside a little bit longer. So I just start monitoring the mare, keeping a closer eye on her, but I don't necessarily really intervene and get more aggressive about things until they're at 365 days.
So would you recommend them getting checked if they're worried at the due date, or just them monitoring at home?
You know, really it just depends. I mean, if this is a seasoned brood mare and you feel comfortable that this mare consistently goes the same day every year, and she always goes, let's say 348 or something like that, and she's going longer than that, definitely. I think if you're not a seasoned horse owner that knows and has foaled a bunch of mares out, I don't think you should take it upon yourself to just be monitoring the mare. I think if you have any doubt or any question, just get the veterinarian out there.
Right.
Especially you'd want somebody that actually has experience with mares, has experience with late gestational or late partum mares, knows what's normal. Not every veterinarian is comfortable with pregnant mares because that's not really their thing. I mean, my husband can look at them, but that's not really what he's good at. And so he would just basically default and tell you to call me. And so, you know, definitely get somebody that you know knows what they're talking about. But definitely, if you have any question, just get the vet out, because it's just going to give you that peace of mind.
Right. Definitely. All right. Well, on to the next question then. My mare is pregnant. Can she have her shots and her dental?
Okay, that's a good question. So the biggest time we worry about fetal development is within the first 90 days of gestation. And during that time, that's when all the organ development happens and a lot of the limb development starts to happen. And so during that time, I try to tell people not to give them anything out of the ordinary. They don't get their vaccines. They don't get, usually I try to hold off deworming, although most dewormers are safe. I tell them to hold off any medications they're going to need to get unless it's something absolutely they need for their life. And kind of hold off on any dentals or anything that's really not a necessary procedure.
Right.
Because anything, you know, we don't know what may affect fetal development. So we want to kind of limit what we do at that point. Later on into gestation, after all organ developments happen, you are safer to do all your vaccines and everything. But in general, I just plan on doing the mare's main vaccines 1 month prior to foaling to get her colostrum. Mares are unlike humans in that humans, they can pass antibodies from vaccines through the placenta to the fetus, whereas with horses, their placental development is different to where that does not happen. And the foals get all of their antibodies after foaling from the colostrum, or the first milk that comes out of the mare. And so we need to boost that 1 month before foaling. So at about 10 months is when I usually give them all of their pre-foaling vaccines, and that's when I really hit them up so their colostrum is best. So I usually time most of the vaccines, if they're only getting them, say, once a year, I time them for that time period. Now, if they're getting some fall vaccines, again, you need to make sure it's past that window before you actually give it. Now, I don't do dentals or anything with sedation right before foaling either. So I wouldn't do that at 10 months. You can wait and do that at another time. But in general, a lot of that routine stuff for mares, I wait till after foaling, and I do it before they get bred back. And so I try to time everything in that window between foaling and when they're getting bred back, so then that way I don't have to worry about it.
Right. You're just taking all your precautions.
Exactly.
Okay. All right. So this kind of follows along with the previous question, but the next question is, how should I deworm my pregnant mare?
Okay, so yeah, along the same lines, I don't deworm within the first 90 days of the pregnancy. After that, most dewormers are pretty safe through the main part of the pregnancy. So any ivermectin-based, fenbendazole-based, which would be like a Panacur, those are all safe. Strongyt's pretty safe as long as you're pretty sure on the weight. You're pretty safe. I try to stay away from Quest or Moxidectin. That is not as, the safety efficacy on that is not as easy as it is for the other ones. So you don't have as much wiggle room with that. So I try to stay away from that dewormer in particular. But the other ones are pretty safe to do in a normal pattern. But in general, on my dewormings, I really like to just do fecal egg counts and deworm based upon that instead of just giving dewormers. The only time I'll give a dewormer is after the first frost to kill the bots that go into the stomach and hibernate in the winter. But other than that, all the rest of my deworming program is based upon fecal egg counts, and I deworm based upon that, because otherwise you're getting parasite resistance associated with it. And then within the last month of foaling to 2 months, I do not deworm them during that time period. Instead, what I do is the biggest time she's going to shed a lot of parasites is right after foaling, because she's stressed. So the foal naturally after birth will start eating manure at anywhere from 2 to 5 days. And that's normal to kind of get his guts. Because foals aren't born being hind gut fermenters. They have to actually get their bacteria through eating manure from their mother. And so because of that, I deworm them right after foaling, within a day or two of foaling, so that way she sheds all those parasites out, so the foal's not automatically picking those parasites up.
Okay. Sounds good. All right, next question. My mare appears to be in labor. How long before the baby arrives?
So, unlike in humans where the water can break and it can be like hours, like for me it was 51 hours.
Oh no.
Yeah, it can be a long time. When you think the mare's in labor, now we have to classify. The mare has 3 stages of labor. She has stage 1, which is where she's starting to be uncomfortable and the baby's getting into position and it's readying itself for delivery. You have stage 2, which is where the water breaks and the foal is actually starting to come out. And then you have stage 3, which is where she passes the afterbirth, which is the placenta. So stage 1, if she's just uncomfortable, that can actually go on in, like, especially mayors that have never had a foal before, which we call maiden mayors. That can actually happen to almost 24 hours.
Right.
Now, when the actual water breaks, which you have to differentiate that, because sometimes mayors at the time of foaling pee a lot in general, but this is going to be like huge gushes of water that keeps gushing out. And it's not usually, doesn't usually smell like urine, and it's not usually bright yellow. It's usually multiple different colors. But in general, when you see this big, huge gush of water, that's the water breaking. When that breaks, that's when we have the time becomes of the essence. And I like to see the foal out within about 30 minutes of that time period.
All right. So then going off of that, it's been 30 minutes, or it's been, this person says 45 minutes. What do I do? I'm not really seeing anything.
Call the vet.
Right.
That's the first thing. Call the vet. You need to get the vet, like, on their way, especially if they're not close. So, like, when I used to have clients that foaled out in the field, I told them that when the water broke, to give me a call, because I would start getting ready to go out there unless everything was going according to plan. Because if it was somebody that was far away, I needed to get on the road, because by the time they figured there was a problem, I'm already, it's starting to become too late.
Right.
Because as soon as the umbilical cord breaks away from the mare, or the placenta starts detaching, the foal is without oxygen at this point. And so the foal is actually starting to become compromised, and this is where we get into a lot of dummy foal problems. And so at 45 minutes, I'm concerned, and there's usually probably some sort of malposition of the foal going on, and I need to go in. You need to have the vet go in and figure out what's going on. I know a lot of people want to get in there and figure it out themselves. The problem is that if you really don't know what you're doing, you can actually cause more damage than good, because if the cervix isn't open, I mean, maybe the mare, maybe you accidentally made the mistake of thinking it was the water breaking, and actually she was just urinating, and you go in there and you're trying to feel around, and then you're ripping stuff, or the cervix isn't even open, and then maybe the mare really wasn't ready to foal, and now you've induced her and she's starting to foal, and you've got a foal coming in too early. Or you just can go in there and start tearing up too much stuff, which can be life-threatening to the mare and to the foal. So in general, I don't have owners intervene in that respect. I tell them just to keep watching them, keep me on the phone while I'm getting out there, and do that. But in general, if you're not accustomed to foaling at your own mare, I know it sounds like this would be something that you would enjoy doing at home, having the birth of your foal at home and all that excitement. I'm going to tell you, from having done this for 23 years, that there's a lot more bad stuff that can happen than the cute stuff that can happen. Yes. And when when something bad starts happening, on the farm, even the veterinarian is limited as to what they can do. My recommendation is you send it to an experienced place to foal out. And I believe, in my opinion, they should go to a facility that actually has a surgical facility attached to it, or be very close to a surgical facility, because if all of a sudden something dramatic, bad starts happening, they can get it to surgery very quickly, versus you being a couple hours away from a surgical facility.
Right. So, yes. And that was actually our next question, is why can't I foal at home? So
it's not that you can't foal at home.
Right.
But again, first of all, it's going to be a lot of sleepless nights. So unless you really can be committed to being up and watching this mare, or sitting up with cameras and having all the alert systems necessary to be there for foaling, you're going to get really tired, and it's going to start affecting everything else. And then the moment the one night you decide to sleep, that's the night she's going to decide to foal. But the biggest reason is because that when things go wrong in a foaling, they go wrong very badly and very quickly. And mares aren't just going to sit there and usually let you do whatever they want. They're in a lot of pain at this point. And so part of the pain process in a horse is self-preservation. That's the whole fight or flight response. And so you don't have the drugs necessary to quiet them down so you can do what you need to do to manipulate the foal out. You don't have what's necessary if there starts to become a problem. You just don't have everything you need to be able to do it at home. Right. So that's why it really needs to go to a facility that actually can handle foaling out mares and that have people there to watch the mare. So that way, I mean, I don't know how many times that I've caught a foal trying to come out the wrong way that literally all I had to do was just go in really quick and move a leg. That was so much easier to do because I was right there versus a mare straining to do this on her own for a while. Now she's getting exhausted. Now the foal's really in a jacked up position and the vet has a harder time manipulating in the right position versus right when she first starts foaling. If things are not in the right position, as soon as she starts foaling, that's the easiest time for me to reposition.
Right.
So go send it to a place that knows how to do it.
Yes. Yes. All right. So this is still within the labor, but somewhat of after foaling. The placenta is hanging from my mare. What do I do?
Okay. Is the foal out?
They don't say, but I'm going to assume that the foal is out.
Okay. Well, let's pretend first in the situation the foal is not out. And you
Okay.
start to see a placenta coming out. So if you start to see what we call a red bag, something red coming out of the mare before the fetus is actually out, that is an emergency situation. You need to get your vet out there right away. They will advise you what to do in the interim until they get out there. So I'm going to let your vet advise based upon what they recommend. But in general, in my facility, I feel to make sure the fetus is actually behind that red bag because every once in a blue moon, that could be the bladder coming out. And that's something you don't want to automatically cut. Right. Because then you've got an even bigger problem. But if I can feel feet and fetus behind that, then I cut that open and I start delivering the fetus because the fetus right now, because the placenta is totally detached, now has no oxygen and now the fetus is severely compromised and is going to have potentially have a lot of problems. If the foal is out, and the placenta is hanging there, that's going to depend upon the time frame. Right. So the placenta, the afterbirth, doesn't necessarily come out right away like it does in people. The afterbirth can take up to 3 hours to come out, depending upon how difficult the delivery was. Sometimes it can take longer, but usually at about 3 to 6 hours. What I have found is you need to get the veterinarian involved if the placenta is not out at that point. Now, a lot of people will talk about, do I tie the placenta? Right. What do I do with the placenta? You can tie it up to get it out off of the ground, okay? But I don't recommend tying rocks to it and bricks to it and stuff like that. Yeah, don't do that, okay? You can take some baling twine and just kind of wrap it amongst itself. I just tied it amongst itself in a knot. But you can take some baling twine if you want to and tie it up that way outside the lips of the vulva. But in general, don't tie heavy stuff to it. Only the weight of the placenta itself is what you want to pull the placenta down. Anything heavier than that, either one can rip the placenta to where only part of it comes out and the rest of it stays in, which can be life-threatening to the mare. Or if there's some reason the mare's uterus is so traumatized, it actually can lead to uterine prolapse, which is an emergency situation in the mare. So you don't want to, if the uterus is already exhausted, to have that much weight pulling the uterus out with the placenta. So just tie the placenta up enough to get it off the ground, leave it there for 3 hours. It's okay. Yeah, the foal might be dancing around it. It's okay. It's really just more of an annoyance than anything. After that, you can call your veterinarian. Depending upon your veterinarian, if it's in the middle of the night, they may choose to wait until the morning to deal with it, and that's okay. I've done enough of these now that the old adage of 3 hours or else she's going to die is not really true. You definitely have to get aggressive the next morning with it. If you have some drugs there that the vet has already given you that can help the placenta get out, great. If you don't, then just keep an eye on it, pull it out as soon as it comes out. Or if the mare's really uncomfortable with it, where she's really colicky, then you need to get the vet out. But otherwise, depending upon when the 3 hour hits, depends upon when the veterinarian's going to come out. But then they'll come out and deal with it at that point and help try to get the placenta out or do things until the placenta is ready to come out.
Okay. All right. Well, our last question is actually our most popular question because we did have quite a few mares have this issue last year. but my mare is close to her due date and she has no udder. What am I going to do?
Okay. So that is a common problem, especially on the East Coast, because we have a lot of fescue in this area. And fescue tends to have, it's not the fescue itself that's the problem. It's not the grass that most people think. There's actually a fungus on the grass that actually is what has the toxin in it that causes what we call fescue toxicosis, which causes basically the mare to not produce milk. And it's basically up in the brain of the mare. I'm not going to get into all of the medical terminology of everything, but the bottom line is part of the receptors that help the mare develop her milk from the brain gets blocked to where the mare's now not going to start producing milk. The other thing it does is it causes inflammation of the placenta and causes it to thicken, which causes decrease in oxygen flow to the foal. So a lot of these foals can have some what we call it used to be called neonatal maladjustment syndrome, but basically hypoxic, lack of oxygen, and encephalopathy, where they have some brain edema and can come out as a dummy foal. But it can cause some neurological problems in the foal as well, and it also can cause prolonged gestation because the foal's brain is not functioning as properly, which the foal's brain is what tells the mare when it's time to foal. Right. And so when the foal's brain's not properly forming, and it's not ready and it's not mature enough or it's got problems, then it's not going to tell her it's ready to come out. And that's when they stay in there too long, they get too big, we start having dystocias, we start having thick placentas, we start having the dummy foals, we don't have milk then for the foal after the fact, which means we don't have colostrum, we start having a whole bunch of other problems. So if your mare has no milk, if she's a maiden mare, which means a mare that's never had a foal before, sometimes those mares will not bag up right away. They may not bag up until right when they're ready to foal. Right. So that may not be abnormal for them, but I would ask your veterinarian to have them come check and make sure. Otherwise, if your mare's out on pasture or eating a mixed grass hay that might have fescue in it, she could have fescue toxicosis. There are drugs we can give her to help break that and start her coming into her milk, and they'll come in pretty quickly once we start her on the medication and we get her off the fescue. So, we can start her on that. She'll still have a little bit of a prolonged gestation. We're going to have to watch her closely, but in general, it will get the ball rolling in the right direction when we put her on the medication. And so, get the vet out there to check that out if she doesn't have any milk. Now, if you've had her off fescue, and she still doesn't have any milk, we'll just have to investigate that for other different reasons. But in general, a lot of people just don't realize that they actually have a fescue problem in their hay. Right. A lot of people forget that hay also can have the fungus in it as well. And so your hay is just as important to make sure that the mares are off of the fescue field and the fescue hay for at least 3 months prior to her due date to help prevent this from happening. But I think I've seen this fungus in other hay types too, because I've seen it in horses that we've not seen fescue in the hay, and we've had some horses have a similar situation. So I do think it's probably in some other grass hays as well. So, anytime you see that, we've got to investigate where that fungus is and maybe change hay and feed sources and pasture situations to help get her off of that situation. But the good news is that, you can combat the situation even after the fact if she has no milk. Right. We can treat the situation postpartum, but if you're noticing it early, there is intervention that can take place, but you need to get your veterinarian involved.
Right. All right. Well, that concludes all of our questions from here.
Yay.
So thank you so much for
answering
all of them. If you guys have any more questions relating to breeding or foaling, or questions regarding the questions we answered today, please feel free to comment on this video or email us at mtvuequinehospital@gmail.com. Thanks so much for watching.
Bye.